Greetings, everybody, and welcome to the International Institute of Trauma and Addiction Professionals. I am Dr. Stefanie Carnes, clinical sexologist, certified sex addiction therapist, and marriage and family therapist, and I am the president of IITAP. We are an organization that is passionate about treating trauma and addiction. And I'm going to talk to you about our programs today. I hope you'll consider becoming a member of IITAP. We have a wonderful community of people also passionate about addiction and trauma. So our first program, and one of our most popular, is the Certified Sex Addiction Therapist Training Program. So we have been the leaders for years in training people on how to treat compulsive and addictive sexual behaviors. So compulsive sexual behavior disorder is now an acknowledged disorder in the ICD-11, the International Classification of Diseases. And we have a whole training program dedicated to working with this very highly specialized population. So our training program consists of 4 modules, and each module is focused in different areas. So module 1 is focused primarily on how to get addicts into recovery, engaged in the process, how to assess them appropriately, and really how to get them to commit to the recovery process. So in Mod 1, we have assessment tools that you learn about. So for example, our SDI is a very comprehensive assessment tool. It is got 47 scales of how to assess all sorts of different types of sexual behaviors. Also, it assesses thoughts and preoccupations and fantasies, and it is normed and well researched. And it is probably one of our most popular assessment tools. It really provides the opportunity for clinicians to hone in and conduct an assessment that is much more rapid and effective than they would have normally been able to do without it. We also have our sexual digital media inventory, which is really focused for people that have struggled with digital content like pornography and sex apps and virtual reality and all sorts of things that are digital. And that is one of our newer assessments. It helps clinicians determine whether it's moral incongruence or whether it's actual compulsive behavior, their feelings about it, what impact it has on them. So those are some of our assessment instruments in Mod 1. You also start to learn about the task model, which is a model, and you'll learn, we have a lot of resources and workbooks and materials that are very hands-on, easy to use, that you learn how to use for your individual therapy and group therapy. And so it's really a focus on getting the addict into recovery, engaged in treatment, and on the right trajectory. So that's our first module. Module 2 is focused on the family therapy component. And I teach in Module 2, and basically we teach about betrayal trauma and how devastating and traumatic it is for partners to learn about their loved ones' sexual behaviors, and we focus on how to support them through that process. Also, we talk about how to run groups. We have a special assessment tool called the IPAST, specifically for partners. It's a battery of instruments that are all validated measures that help assess betrayal trauma in our partners. During Mod 2, there's a heavy focus on the disclosure process. And in that section, I actually share my own videos of me conducting a disclosure, also the post-disclosure repair process of doing an impact letter, emotional restitution to try and help the coupleship heal. So we have numerous interventions that we focus on that are couple and family related, such as the Cartman Triangle. We also have a morning talking about how to support children and the rest of the family. So that's our second module. Module 3 is focusing on the more advanced recovery tasks. So Mod 3 focuses on things like healing shame and grief and what happens when you have multiple addictions, when people come to treatment, how to work with that, how to work with things like money and lifestyle balance and trauma. And so you learn numerous recovery tools that take the client to a deeper, more profound level in their work. And the hope with the task model of treatment is that because there's so many rich, engaging materials, that the client will stay invested. We want our clients that we look at recovery from addiction as a long-term process, and we want to keep our clients engaged. So my father, Patrick Carnes, talks about needing to grab onto the frontal lobes and hold on. And so the materials are really engaged or really work towards keeping the client engaged in the treatment process. Module 4 is also, it contains extra advanced recovery tasks. It also, we look at healthy sexuality, issues around fetishes and offending and other components of sexuality. We also have a focus on evaluating our own biases in sexuality and sexual health. So we focus on that area. We also focus on women and cultural diversity in Module 4, how to look at how does this really affect females in a different way from males, and male partners of female sex addicts. Also looking at cultural issues, and we get to do case studies from different cultural backgrounds. And then also in Mod 4 we do look at treatment planning and relapse prevention in a deeper way. So that's a general overview of our CSAT program. One of the really neat things about it is it's really taught by experts in the field. Our faculty are fantastic. Most of them are authors and leaders and well-known in the field. So we feel that it's a real quality educational program. Another thing that's wonderful is our community, and we have a very active listserv. We have over 1,000 people that are actively participating on our listserv. So whenever you have a question, we also have a lot of consultation and supervision available in our community. And this is a complicated area of treatment, and so it's really nice to have that support for you as a developing clinician. So that's one of our main programs. We also have a betrayal trauma treatment program. It's called the CPTT program, the Certified Partner Trauma Therapist program. And this focuses on, this is only 2 modules, and it really focuses on working with partners and betrayal trauma and how to support partners in a more profound and deeper level. We have a large section in here on disclosure, again, supporting couples through disclosure, on how to help partners, how to treat the trauma of being involved with a sex addict, and also things like cultural diversity and couples therapy. So it's also a very extensive program. Finally, we have our PSAP program, which is our Pastoral Sex Addiction Professionals program. So this program is really geared towards what can pastors do to be in a supportive role for people that are struggling with compulsive and addictive sexual behaviors. So it really looks at what pastors can do within their scope of practice and focuses on spirituality and the spiritual support that pastors can lend. It gives a lot of background and education, what is appropriate in terms of group in church settings. And we also have a wonderful resource in terms of materials for our pastors, workbooks and whatnot. So that is our pastoral program. And we also have a certified multiple addictions therapist program. So if you're interested in having a background in multiple addictions, this program trains, has a module on chemical dependency, gaming and technology addictions, eating disorders, money and work and financial disorders such as gambling and workaholism. And so that gives you a much broader range in addiction. We also are constantly offering programs in trauma for our community, different specialty programs in many of the different exciting trauma treatments that are popular today. And we have an annual symposium where our community comes together, and it's just a wonderful time to reconnect and learn more about our passion of treating addiction and trauma. So I hope this has been informative. Please don't hesitate to reach out to us and peruse our website if you want to learn more about our programs. And thank you for your interest. I hope to see you at a future training.